Coming up next on Arizona Horizon, we continue our discussion on the Senate's proposed health care bill with a look at what could be a better idea from Nevada. Also tonight, NASCAR fans will see some big changes the next time they head on out to Phoenix International Raceway, and how a father's art was passed down to his son. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. Encouraging news regarding the Goodwin fire southeast of Prescott. Residents of Mayer were allowed to return to their homes this morning, with power expected to be fully restored to the town by this evening. The Goodwin fire has burned nearly 25,000 acres of the Prescott National Forest, but suppression efforts are working, and officials now think that the fire could be fully contained by July 4th. A number of smaller communities in the area, though, continue to be under evacuation orders, and State Route 69 is still closed from I-17 at Cordis Junction west to Highway 169 near Prescott. No word on when that stretch of road will reopen to the public. And Arizona will continue to offer in-state tuition for students eligible under the DACA program. This as the issue is under court review. Last week, a state appeals court ruled that the immigrant students are not eligible for lower in-state tuition, but the Maricopa County Community College District took that case to the state Supreme Court, and today the Board of Regents said that in-state tuition will still be offered until the Supreme Court acts. Each night this week, we've been getting reaction to the Senate's proposed health care bill. Tonight, a look at what could be a better idea recently considered in Nevada. It's a plan to replace the Affordable Care Act at the state level with a Medicaid for Many plan. Here now to talk about the proposal is Will Humble, the Executive Director of the Arizona Public Health Association. Good to see you again.
Hey, thanks for the invitation.
You betcha. Thanks for coming back here. Nevada tries to replace, but the Affordable Care Act, which is almost, you can't even say it anymore, Obamacare, because everyone wants to get rid of it, it seems. However, Nevada's got an idea of tweaking a little bit and making it at the state level. Explain this.
So they had a real novel idea, I think, which essentially goes like this. For people on the, so let's start with this. A lot of the angst about the Affordable Care Act has to do with the things that have been happening on the individual healthcare market. Those people that don't get insurance at work, they're not enrolled in Medicaid, they're not Medicare, they're sort of in that limbo land on the individual market. And that's the place where the premiums have been so unstable. So Nevada took a look at that and said, hey, what if we allow folks in Nevada on the individual insurance market, in other words, the marketplace, to buy our state Medicaid program insurance, pay their premium, full freight, you know, we're not subsidizing anything, we're just taking advantage of the big risk pool that exists in Medicaid and the negotiating power that state Medicaid programs have with the provider networks to get those premiums really low. And so the state legislature passed the bill, sent it to the governor, and unfortunately, at least I think unfortunately, he vetoed it. It would have been a great experiment to see how we could leverage Medicaid programs to really reinforce and stabilize the individual healthcare market.
So any resident, as we mentioned, could buy in to the state Medicaid program regardless of income and regardless of need.
Right. So you're just saying, hey, we've got this Medicaid program. If you'd like to buy this insurance, here's the network that exists. Here's what it costs. We will provide you with a mechanism to buy in, and it would really be a pretty stable health insurance market because of the economies of scale that you get in state Medicaid programs. So, for example, in Arizona, we've got about 1.9 million people on Access, the state Medicaid's program. That's a big risk pool. That's almost it's a third of the state almost.
That's true.
And the reason why some of these individual market, the insurance market, is so volatile is because it's an unknown risk pool. It's smaller and it becomes more volatile because of that. This allows people to take advantage of that economy of scale that exists, and you know, the infrastructures already exist in all 50 states. Every state Medicaid program is a little bit different. We're in a really good position because of the nature and efficiency that our Access program has.
And I want to get to Arizona possibly adopting something like this in the future. But as far as helping folks, correct me if I'm wrong, in Nevada, existing tax credits through the Affordable Care Act, those could be used instead to help folks pay for premiums and plans and these sorts of things?
So the way their bill was crafted, you'd be able to buy into their state Medicaid program, but you could also use your Affordable Care Act, advanced premium tax credits, and cost-sharing subsidies to help reduce that premium even further. So to give you a benchmark example, in Arizona, that would be something in the neighborhood of, to start with, about $300 per person per month, ballpark, not exact figure, but close. And then you subtract that premium. You can add in your advanced premium tax credits, your cost-sharing subsidies. Your actual premium would be actually a lot less than that, and
yes,
it would be stable because you're in this big risk pool called Medicaid.
But it constitutes a subsidy, does it not?
Well, it's the same subsidies that exist under the Affordable Care Act.
But that's part of the problem with the Affordable Care Act as far as the political aspect.
Some people say.
Yeah,
right.
I mean, they don't want that subsidy.
Some people don't.
So this is tinkering, this is messing with, not a pejorative, but messing with the Affordable Care Act and making it again on the state level. And again, you have to go through the state marketplace. You have to, if you're involved with this, marketplace has to be involved.
In the Nevada plan, you could go through the marketplace to get the Medicaid health insurance,
yes,
and buy your way in. So it's not exactly repealing and replacing the Affordable Care Act. What it does is fix the volatile price problems that we've had on the individual market, which if you turn on CNN and all those national news programs, you'll hear one person after the next complaining about the volatility
right
in the individual market. This is a great solution to getting that volatility under control and having pretty affordable premiums and a decent network.
If it's such a great solution, what was up with the governor vetoing this?
He had a statement when he vetoed it, and he said it's there's too much uncertainty with this or something like that. You'd have to bring around the program to find out exactly what his real reasons were. I don't know him. I don't know why.
Okay, is this a good idea for Arizona? Because Access, as we've mentioned many times on this program, Access, our state Medicaid program, it's a model. I mean, it works well for what it's supposed to do. Would it work well under this kind of scenario?
Well, I think it would. Yeah, I think it has a real possibility of helping the individual market. That would be. In Arizona, we have about 180,000 people that buy their insurance through the marketplace. Right? So this is really a solution for that universe of people, that yes, 180 to 200,000 people, up to 220,000, something like that. Those are the people that are stuck in the middle, that are buying the marketplace insurance, where the premiums have been in flux over the last few years.
Okay, so it would be feasible. Would it be feasible for insurance companies? Because the big problem here in Arizona is they're all fleeing for a variety of reasons. Would they start coming back under a scenario like this?
You'd have to bring them on the program.
But what do you think? Do you think that they're...
Here's the thing. Here's what I think. I think yes, because what insurance companies fear and hate, not just health insurance companies, but any insurance company they don't like uncertainty. They don't like volatility. They like to be able to predict exactly what it's going to cost. There's a long track record with our state Medicaid program. Now, these are different people. They're not people that are, they're not currently enrolled in Medicaid. So it's there's different folks that we're talking about here. But because it would be inside a known Medicaid entity, it provides more certainty, and that's what insurance companies like.
Would something like this work on a grand scale as a national plan?
I think it would work in those states that have mature managed care Medicaid programs like ours. Right? So we are in, there are some states that still have fee-for-service type of Medicaid programs. I'm not so sure this solution would work well in those states, but it has a really good chance of working in states like Arizona that have a Medicaid program that's built around a managed care model.
So out-of-pocket...
And Nevada's is a lot like ours.
Out-of-pocket costs compared to the current system and the volatility of pricing compared to the current system.
Much less volatile and lower premiums than we have today on the individual market.
Well, it sounds like a very interesting idea. It sounds like it could work, and it sounds like it makes so much sense that I'm not surprised the governor vetoed it up there in Nevada, because it just seems the way of the world these days. Well, it's good to see you again.
Hey,
Thanks for joining us.
All right.
Coming up next on Arizona Horizon, what's in store for NASCAR fans at the new and improved Phoenix International Raceway?
I was at the post office mailing something. I asked the clerk, "How do they let you know if your son is wounded?" It was very hard for me to form those words, but I just felt, I've got to know. I just felt so suspended in space and anxiety. And the man said, "Now, don't worry. They'll tell you."
Phoenix International Raceway is undergoing a $178 million makeover. The project includes a number of changes, including new grandstands, a new start-finish line, and a new infield where fans can watch the action close up. Brian Sperber is track president at PIR. We welcome him to Arizona Horizon. Good to have you here.
Hey, thanks for having me on.
All right, $178 million makeover. Was it about time? Are you looking for...
It's a heck of a credit card bill.
I was going to say, by the way, who's paying for this?
Yeah, we are. So a lot of people don't realize Phoenix Raceway is owned by a publicly traded company based in Florida called International Speedway Corporation. And our parent company owns and operates 11 other NASCAR tracks around the country. And so when it comes time to have an investment of this size, it's nice to have that backing. And so we went to the board of directors and asked for a capital investment, and pleased to say that they agreed with us.
And I'm sure you're pleased to let taxpayers know they're not paying a dime for it.
That's correct.
All right, let's talk about moving some dirt around out there. Why now? Why this expansion?
Sure. Well, you know, our facility is fairly long in the tooth. We were built in 1964, so it's getting up there in terms of major sports facilities in the Valley. I think we're the oldest now. And today's modern sports fan and modern sponsor and even the race teams now all have higher expectations of what a venue should be in terms of meeting everything from creature comforts to being able to activate different types of programs. And so the facility was really starting to hold us back. And the fans, and we've got a terrific group of fans that support NASCAR, but you know, they're also looking at some of these other stadiums and they're saying, you know, why can't we have some of those creature comforts? And you know, and our sponsors are looking for those kinds of things as well. So,
yeah.
And you know, we've got the semifinal race in NASCAR's playoff, and so we're going to continue to have the eyes of the sporting world on us in November. And the facility, we really needed to raise our game.
You're going to move the start-finish line. For anyone who's been to PIR and you're in the grandstand and you're kind of facing the straightaway there, that first turn was off to your right. You had to go like this to go see it. You don't have to go like this anymore, do you?
You won't. And that start-finish line will move actually in November of 2018 when the project is fully completed.
Okay.
Grandstands will move over to that side of the racetrack. It's what we call our dog leg, and it's become kind of our signature turn. It's one of the most exciting turns in racing. This is the place where the drivers will what they call dive bomb, and so they'll go down onto the apron. And Dale Earnhardt Jr. was out with us a few months ago, and he described it in a good way as chaos. And so that's where the start-finish.
So we're looking at right now, those will be, is that new grandstands facing that start-finish line, correct?
Yeah. So if you look at the facility, that's if you were to kind of divide that picture right down the middle, everything you see to the right will be brand new. And the grandstand, all the grandstands there on the right will be essentially right behind start-finish line. So the start-finish line will be right in front of those seats.
Hey, okay, so you get to see where, and here's another kind of look at it. Right again, that is start-finish line. Those are new grandstands.
Yeah, that's right. And I think one of the fun things about moving the start-finish line over there is that imagine the restarts. You know, after a caution or one of our stages, and the field is fully bunched. That restart is actually going to be happening in a turn, and we'll be the only racetrack where this will take place.
The fisticuffs.
I'm getting excited just talking about it. Yeah,
these guys getting fist fights over, you know, spilling chocolate on each other. All right, so the grandstands are moving. The seats are going to change as well. No more bench seating?
No more bench seating. So we'll have individual seats. We're putting in escalators. We're putting in elevators. And so in our world, we call that vertical transportation. You know, I mean, I'm old enough to remember it was just an escalator and an elevator. But fans are going to really love it. We're going to be able to get them to their seats and to the locations around the venue in a very convenient way.
Now, you're also building a tunnel so that fans can go into the infield.
Yes.
That's pretty interesting stuff there.
Yeah, it is. And here's a little fact I'll share with your viewers that a lot of people don't know. We repaved and reconfigured the racetrack back about 6 years ago, and when we did that, we had a feeling, and so we actually built the tunnel during that project, but we never opened it up because we needed the full project to be completed, and we're able to do that now.
This is the kind of stuff you'll get in the infield here?
Yeah, now this is really amazing. This is a breakthrough, and what's the one area that sports fans always want to go to? It's the locker room, to get into the locker room before the big game, or in NASCAR's terms, to be able to come into the garage area. And we challenged our designers and architects to try to create a way in which race fans will be able to get up close to their heroes and to the teams. And so that garage will do that, and fans will be able to come in through the fan zone, go right into the NASCAR garage. It's unprecedented.
One last thing about the actual seating capacity here, dropping it from 50,000 to 45,000. How come?
Yeah, we are. And actually, the final number hasn't even been fully worked out yet.
I heard 45,000, but somewhere along in that neighborhood?
Yeah, we're definitely going to shrink the venue. And what we're seeing in sports today is really a shift from these sort of mass events of hundreds and hundreds of thousands of people, where admittedly the experience, can't be premium because of just the sheer numbers. The sports fans today really want to have a more premium experience, whether it's baseball at the Diamondbacks or the Suns, or at NASCAR at Phoenix Raceway. And so the way we're able to deliver that is with a smaller footprint, individual seats, escalators. We're going to be the only racetrack with Wi-Fi, and so we're going to be able to deliver all these technology experiences. And so that's really what the race fan and what the sports fans want today.
Did NASCAR and IndyCar, did they have to agree to these changes? Did you even go to them with these changes?
Oh yeah, if we didn't, we'd be in trouble. So yeah, we want to make sure they definitely knew what we were doing. And probably the biggest change was the start-finish line. And so I personally went and visited with all the NASCAR drivers ahead of time and said, hey, do you see any problems with this? And every single driver said, you know what, we think it's cool, we think it's going to be great. They were all excited, and then I knew we were onto something, and we had confidence to go forward.
You know, I remember covering NASCAR races back when PIR sometimes got washed out. You couldn't get to it because of the river overflowing.
That's right.
I mean, that place has been there a long time, and obviously, from what we're seeing here, I mean, massive work being done. How big a deal is auto racing in the Valley?
You know, I think it's a huge deal. It's an incredible, obviously, economic impact because so many race fans from other parts of the country come here, and they're filling up our hotels and our restaurants and spending money here in the Valley, which we really love. But also, you know, we've got national network broadcasts coming from Phoenix all over the country, and it's telling the story of what a great place the Valley really is to vacation, to do business. And we've got CEOs and decision makers from the Fortune 500. Today in NASCAR, of the Fortune 500, it's roughly about 130 of the Fortune 500 companies are invested in NASCAR. We're able to get a lot of those decision makers here, and that spawns other business opportunities, which we all can benefit from. So all in all, it's a really powerful economic engine.
All right, so keep an eye for some shovels, some work out there for the next, year or so, 18 months, something along those lines?
Absolutely, yeah, we'll have some improvements, but circle your calendar. Grand opening, November 2018.
All right,
expect you to be there.
All right, good to see you. Thanks for joining us.
Absolutely, thanks for having me.
Get the inside scoop on what's happening at Arizona PBS. Become an insider. You'll receive weekly updates on the most anticipated upcoming programs and events. Get the insider delivered to your email inbox. Visit azpbs.org to sign up today.
Parents often pass down traditions to their children. In the case of one Scottsdale man, the tradition has turned into a passion and a career. Producer Shauna Fisher and photographer Rob McJanet visit the gallery of sculptor Philip Payne to see how he's forging his own path while honoring the legacy of his father.
This was my dad's tabaret. At 5, 6 years old, I guess 6 years old, I would do colored pencil drawings.
You could say Philip Payne was born to be an artist.
And I would dump out my dad's briefcase and fill it full of my drawings, and I'd sneak out of the house and go door to door selling them. This is an anatomy book.
Philip moved from drawings to sculpting, and by doing so, followed in his father's footsteps.
My dad was a world-famous bronze sculptor.
His father was Ken Payne. Known as the modern-day Remington, his works mostly are of cowboys or Western images.
I didn't want to just throw to the wind all of the anatomy my dad taught me.
The elder Payne was known for his exquisite attention to detail.
See where these deep tissue muscles are?
And Philip is continuing that tradition,
So that it feels like you're looking at a horse.
but with his own style.
I like using books as a source of inspiration because it really gets your creativity going, and it's very much triggers your own creativity. It's geometry meets Ken Payne.
Philip has been creating bronze sculptures since he was 14.
I'm primarily an additive sculptor.
His first piece depicted the legend of the Spanish Mustang, often considered the most credible legend in United States history.
And then I came across the specific part where a settler saw it had to have this horse. He had hired trackers, they'd go looking for it. And one day they finally find it, they start chasing it towards the edge of a canyon. And maybe they expected it to turn or slow down, but it said it picked up speed as it reached the edge, and when it got to the edge, it jumped. And so I sculpted the piece where you can kind of picture a canyon there in front of it. And according to legend, made it to the other side. It was this, impossible jump, which now has even been used in cartoons and movies, referenced a few times, that legend.
Philip cast the bronze horse many times, and it sold out. He saved one for his gallery.
And horses are so powerful.
The legend of the Spanish Mustang was a turning point for him.
Left with a much greater appreciation of our history and our culture.
He had worked hard on the sculpture, tearing it apart and redoing parts of it, heeding his father's advice.
He always said, if you can't do it twice, you shouldn't be an artist. Make it shiny. And every time you do it, you'll do better and better. It's hitting that bone.
Now 31 years old, Philip has his own studio gallery at Kierland in Scottsdale.
I kind of designed this composition and with that in mind.
The gallery showcases his work and his father's, but also dozens of other artists, including Philip's wife Gabby's paintings.
Everything we've done, my wife and I, we've done ourselves.
Philip spends most of his day in the front of the gallery sculpting. Passers-by are often moved to come in and inquire.
It's that bond that you make, and so when they come in, the greatest advantage is that they know they're in a studio gallery and they know that they're free to explore and ask questions and that we're knowledgeable and we're happy to share.
Philip uses his father's anatomy books when he's sculpting.
But this is for horse anatomy.
He says the best sculptors will sculpt a body first, muscles and tendons, and then adding clothing or fur on top of that, creating a much more realistic look.
Smooth points when you look at your knuckle and you squeeze your hand real tight, that you just see bone.
Philip is now experimenting on a new style.
I'm also going to be branching out and really exploring some of these, shapes. My dad always talked about how you're sculpting a diamond, and so I'm kind of taking that very literally and making my work very faceted and things like that.
Bronze has been around for centuries. The first bronze statue is believed to have been created in 2500 BC. To create a bronze work, artists begin with a clay model. Creating a bronze like Philip's pieces or his father's is a 13-step process, as shown in this TV special about Philip's dad. After the clay model is made, latex is spread over the clay. This will form the negative mold.
Now, molten wax is poured into the mold, forming a perfect original sculpture. The wax is then carefully removed from the mold.
The wax is dipped many times in a silicone slurry. The wax portion is then melted away in a kiln, and all that's left is a ceramic mold.
Bronze, an alloy that is 95% copper, is poured at 2,150 degrees Fahrenheit.
The final steps include breaking away the ceramic and cleaning up the bronze and attaching any pieces, and then adding a patina. All in all, the process can take upwards of a year.
It's a lot like composing and then conducting a symphony.
Philip says, unlike other artwork, bronze has an infinite shelf life.
I love the permanence of bronze. I love that it lasts forever. But our reaction as people to bronze is very different. You know, if you have bronze sculptures, you know, you come in and there's a story behind it, and the family usually knows the history. You know, it's like Dad tells the story to the grandkids, the great-grandkids, you know, and everybody, and they can hold values very much, like family values, you know, of tenacity, of strength, of courage. This is where all the power in a horse comes from.
For Philip, making bronze is about connections.
That probably is what launched my dad's career.
To his father and to his family.
I'm really liking all of this.
And most of all, to the community.
I always say art's the search for kindred spirits. You know, you put your heart into what you make. Kind of read true.
Again, Desert Mountain Fine Art Gallery is located at Kierlands. For more information, head to desertmountainfineart.com. That is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you.